the cost could be cost prohibitive, and really when you try to add both of them in there. So I may be able to purchase, let's just say I budgeted $200 a month for this, but now it's going to cost me $400, and now I can't afford it at all.
Covering the Capitol debate tonight over a controversial bill that could change how gender-related medical care is handled in our state. Lawmakers are considering a bill that would, among other things, limit what local governments can ban for transgender people and add new rules for clinics and require more reporting and oversight. Fox 17 News' Hope Salmon live tonight downtown near the state capitol with more on what this bill calls for.
Scott, the bill touches on several parts of the healthcare system, like what clinics and insurance companies must share about transgender patients. The bill would require gender clinics to keep records on the number of procedures it performs and share that information with the state health department. That includes the age and sex of the person, drugs used, the state and county where the patient lives, and contact information for the medical professional who prescribed the care. No personally identifiable information would be included. Sponsor Jeremy Faison of Cosby says his bill also targets insurance companies.
What we have seen historically, there are individuals who have decided to go through transition. There are some insurance companies who, if a person on the outside of the transition side, you know what, I've made a mistake, I want to go back and detransition. A lot of times, I've met them, they've been in my office, testified last week, they have nothing. They don't get the help, and it costs a fortune.
The bill would require insurance companies that covers gender transition procedures to cover detransition procedures. Critics argue this removes the freedom of choice for the transgender person.
I think we need to give people more options instead of less options. We're mandating something on a person who can even afford to buy the insurance now.
The bill would also stop cities and counties from banning certain types of mental health therapy for minors dealing with gender identity issues. It also makes clear parents and guardians have the final say on whether their child receives that therapy. Healthcare providers could face discipline for not reporting, including a suspension of at least 6 months and a fine up to $150,000. The full House is scheduled to vote on this bill next week. I'm reporting live in Nashville. I'm Hope Salmon, Fox 17 News, your Code Red station.